I have chosen need to emphasize my research and provide justification for further research and study, supporting the needs of the study is following, Determine the amount and type of stress that critical care nurses experience as a result of their day-to-day work environment. Determining effective coping skills used by critical care nurses to help manage stress. The several factors unique to nurses' work environments add to their vulnerability for burnout. First, nurses spend an increasing number of hours each day involved in patient care, especially with the advent of extended shifts and overtime. Second, changes in healthcare delivery have created feelings of disillusionment and uncertainty among nurses. Third, nurses have made efforts to overcome the traditional domination of physicians, and nurse-physician relationships have been documented as a common source of stress for nurses. Ethical consideration. Take written permission from selected hospitals. Objective and purpose of the study will be given to the authority. The researchers adhered in conformity with the congeniality provision about the taking part hospital. The nature of the study will be basically descriptive with the surveys. No experimentation or intervention takes places. An informed consent will be given to all participants who will attach to the surveys they received. The informed consent, the purpose of the study and their right will be notified to all participants, as well as all ethical consideration is taken by the researchers. The specific objectives of the study. To assess the level of burnout among the staff nurses working in critical care unit. To assess the coping strategies used by staff nurses working in critical care unit. To find out the association between the burnout and coping strategies used by staff nurses working in CCU. To determine the association between the burnout and coping strategies with selected demographic variables of staff nurses working in CCU. Significance of the study. A tentative insight into the natural world, a concept that is not yet verified but that if true would explain certain facts or phenomena. H1, there will be a significant association between the burnout and coping strategies used by staff working in critical care unit. In this study, the reliability was done on 10 samples selected according to predetermined criteria, and the coefficient of correlation was calculated by Pearson's formula. For testing internal consistency reliability, the correlation coefficient is calculated by using Pearson's formula, and obtained value of R for burnout tool is 0.72 and for coping tool is 0.85, which indicate high correlation. Thus, the reliability of tool is proved. Therefore null hypothesis rejected. Scope of study. The study of burnout and coping strategies adopted by nurses in critical care unit will help the management to consider each employee generational difference of values, belief and opinion that influence her work ethics and regards to employee productivity. Allow the healthcare professional to express emotions and concern without an inappropriate reaction by adopting positive copying strategies. Help change the attitude and outlook of the nurses. Create a sense of responsibility in the nurses towards the job responsibilities. Help in planning for better quality care for their clients.